everybody. Welcome to Your Money Map, sponsored by the Alliance for Lifetime Income. I'm your host, Jean Chatzky. Very glad to have you along with me today. And I think you'll be happy to be along for the ride as well, because we are talking about a subject that I know lights these message boards right up. The link between your health and your financial security, the questions that you have about long-term care insurance, accessing it, paying for it, the questions that you have about long-term care in general, and what's the best way to make sure that you are situated financially and health-wise for the future. My guest today has been doing this for 30 years, so he is an incredible resource to have with us for the next 45 minutes. His name is Marc Cohen. He is a PhD and co-director of the Leading Age LTSS Center at the University of Massachusetts, Boston. He's also a professor of gerontology and research director at Community Catalyst. And before joining UMass Boston, he was Chief Research and Development Officer, former president and co-founder of Life Plans, which is a long-term care research and risk management company. In other words, he has spent the last 3 decades living and breathing the long-term care situation we have in this country and trying to figure out solutions for how to deal with it. Marc, welcome. It's terrific to have you here.
So happy to be here with you, Jean, and I'm glad that after 30 years, I'm still living and breathing this.
Me too. Absolutely. And I want to also just welcome our audience into this conversation. As regular viewers of this program know, we like it to be a conversation. Whether you are joining us on Facebook, whether you're joining us on LinkedIn, if you have a question, if you have a comment, please type it into the chat, weave it into the comment section. I will be on the lookout for those things, happy to bring them into the conversation. And if you have a question, to tee it up for Marc so that you can get an answer. But let's start, Marc, with just sort of some framing questions. When we're thinking about our health and we're thinking about our financial security, how are the two interrelated at this point?
So, Jean, they are completely related, frankly. And when you think about our generation, we're the first generation to reach old age, not by accident. Most of us now expect to live to be over age 65. And that means that we need to pay for a greater span of our life outside of the labor force. And we need to do that at the same time that we have increasing health liabilities. And so when you look at the data, what you find is that there's a very strong link between financial security and health status. And in particular, that link is strengthened and somewhat more worrisome for women, for people of color, who tend to have somewhat greater numbers of either chronic illnesses in the case of ethnic and racial minorities, and for women who tend to live long enough to actually experience some health challenges.
So as we go through our lives and we're trying, because, we live in a world unlike our grandparents and some of our parents, where the lion's share of responsibility for paying for and managing both our health and our financial security is on our shoulders, right? At least until we get to Medicare, we are responsible for paying a bigger share of our premiums, our co-pays, our prescription drug costs every single year. We don't have the pension system anymore. We're responsible for putting money into a 401k or another retirement plan. What's the best plan of action for navigating both of these things so that, and I love how you put it, that we are the first generation not to live to old age by accident. When we get into our 70s, 80s, God willing, our 90s, what's the best plan of action for us to get there healthy in both aspects?
Thanks, Jean. Well, first of all, don't wait till you're 70, 80, or 90 to start planning and thinking about it. I mean, I think if there's any piece of advice I would give in this area, it would be that you need to start thinking about it at young ages. It's tough to do because we used to talk about the sandwich generation, the people who would be caring for both children and older adults. Frankly, I think of it as the panini generation, totally getting squeezed right now. And when I say that you need to start thinking about these issues earlier, there are a couple reasons why. One is, I think a lot of people assume that when they become eligible for Medicare, that that's going to take care of most of the costs that they're going to face as they get older in their 70s and 80s. Unfortunately, that's not true. As a matter of fact, Medicare leaves out paying for long-term care. And the liabilities that are associated with long-term care are, quite significant. So you don't have a large public program to pay for that. So what are you left to do in your 40s, in your 50s? I would say, unfortunately, there's no silver bullet. Mm-hmm. And it has to be a multi-pronged approach to addressing this issue. And so here are some things to think about. Here are some things to consider. You might, if you have the financial resources, you might explore private long-term care insurance, which is insurance that is specifically designed to pay for home and community-based care services, nursing home care, assisted living care, should you require, assistance with activities of daily living and need long-term care. So, and there are different types of policies. We can talk about those later.
Okay.
The second piece is to really become familiar with the service system and network in your own community. Costs of care, while they're generally expensive across the United States, will vary fairly significantly. Like, I wonder how many people listening today actually know if they needed a nursing home care, how much would it cost them every day? Or if they needed home care, would they know, where do I go get it? How much is it going to cost? Take the opportunity to learn about your service system.
Well, if we're gonna try to put a number on those costs, what's the best resource to use for that? I mean, I'm a pretty expert Googler, but I don't know that I would know immediately where to go to put my fingers on those costs in my own community.
Great question. And actually, here I'm happy to say we actually have a concrete answer. One of the long-term care insurance companies, Genworth Financial, every year conducts a cost of care survey. And you can go on their website, I think it's genworth.com, and type in cost of care. And if you put your zip code in, it will tell you exactly what the average or the median cost of a day in a nursing home is, or I think it's monthly costs, home health care, assisted living. So you can actually go right there and find out. Another avenue to look at, for example, let's suppose you think, or somebody in your community, even a parent, needs nursing home care. The government has a website, Medicare.gov has something called Nursing Home Compare, which allows you to look at different dimensions of facilities in your community. And I'm imagining that there are a number of states out there that also make available that sort of resource. So it does exist. I mean, there is information out there, and it would behoove people to become familiar with it so that you know what potentially you're facing.
Yeah, 100%. Because I think, when we think about our healthcare related costs in retirement, they tend to sort of fall into a couple of buckets, right? Those that will be paid for by Medicare, those that won't be paid for by Medicare, and then what happens if you can't afford either one and qualify for Medicaid. Can you sort of give us a top level explanation of how that works?
Yeah, that's I'm so glad you brought up the Medicaid. Medicaid is basically a state and federal partnership that is considered a social safety net program. So for people who don't have the resources, let's say, to pay for primarily institutional care, Medicaid will pay. But it's not quite that simple. So let's suppose you're a middle class individual. You've saved, you've done everything right your whole life. You've saved money for retirement, and you have the unfortunate situation where you become disabled and unable to perform activities of daily living. Suppose you need home care or nursing home care. You do not immediately qualify for Medicaid. You have to spend down your assets and your income until you reach eligibility levels. And what does that mean for people? It basically means that you have to impoverish yourself in order to qualify for that program. If you're already have relatively very modest or poor, the program is there for you. The other problem is that Medicaid is under a lot of stress as a public program.
Yeah.
And so sometimes it's harder to get home and community-based care. There are waiting lists. States are looking for ways to cut back because of the financial cost in their budgets. So it's there for you, but most people don't view it as an optimal solution to addressing the need during retirement.
So like I said, this is another one of those things that is likely to fall in our laps, right? I mean, if you are a person who is earning and saving for their own retirement, figuring out some sort of a solution down the road that can help you manage your long-term care expenses, whatever they happen to be, is an important cog in the wheel. You mentioned long-term care insurance policies. How do we think about these policies? What are we trying to insure for?
Great question, Jean. And I should mention, I will spend some time on long-term care insurance, but there's been some challenges over the last decade in that market. But just to level set, so a long-term care insurance policy is a private voluntary insurance that you buy. And what it covers is if you become, let's say, unable to perform certain activities of daily living like bathing, dressing, toileting, those are the things that really necessitate the need for long-term care. If you can't perform those activities, then the insurance policy typically will reimburse your cost of services. And they're very good policies in the sense that they cover a broad range of services. So today they're designed to try and help people age in place, age in their home. Most people don't want to go to a nursing home. And certainly the pandemic laid bare what happens to a system that is underfunded, like nursing home care.
Yeah.
So the idea of that insurance then is to give you the financial wherewithal to be able to pay for care. Right now, by the way, most care is actually provided by family, adult children, primarily women, and spouses. I didn't mention this at the outset, but you just reminded me with your question, Jean, that long-term care is it's a real woman's issue for two reasons.
It is, isn't it? I mean, I'm thinking as you're speaking, I'm thinking about my mother actually, and my mom is not in need of care now, right? And we are around to help her if she is in need of care. But she recently lost my stepfather. Before that, we lost my father. She's likely not going to get married again if you ask her at 82 years old. She will be, a single woman. And most of us outlive our spouses. That's just the way that the longevity curves seem to be going these days, which means that we are not going to have spouses to take care of us. And when you look at demography these days and the fact that many millennials are opting, not to have children, we're getting to a point where we're asking, okay, who will take care of all the older women?
You are so right. It's a double whammy. On the one hand, the majority of caregivers who are providing care to disabled relatives and stuff are still women, okay? Which means that they are giving up wage opportunities, saving for retirement, and so on. And then oftentimes they outlive their husband, as you mentioned, because of longevity, and they reach that period where they're more likely to have long-term care needs. So, and there's long-distance caregiving issues. Family structures are smaller. Children are not living. So one other thing to think about, like, well, I don't want to paint this like horrifying picture. There are things that can be done. I mentioned the insurance. There's another thing too. In addition to just learning about your service system and how to access care, there is a movement called the Village Movement, where neighbors and friends are getting together and sort of informally offering to help each other.
Mm-hmm.
If somebody has a need. And you can think about this like, if I have to go grocery shopping for my neighbor, and that maybe I bank the time so that when I need care, I build up a certain number of credits, or I help somebody to organize. So you see at the very local level, and people can start thinking about that. We all have close knit sets of friends and maybe relatives nearby. Think ahead about how we might come together to help each other.
We've gotten some comments, and I want to make sure I turn to them. Mind Your Money said that they appreciate the term panini versus sandwich generation because it is a squeeze that people are feeling. I agree with you. And a question from somebody who's nomadic, how this affects you continent to continent. I actually think before we think about continent to continent, we have to think about state to state, because those Medicare and those Medicaid rules that Mark was speaking about sort of differ state by state as far as what those programs are able to offer. Can we dig into the long-term care insurance landscape a bit, Mark?
Sure.
I know, because I bought a policy not too long ago, that there are now different options than there used to be, right? We're not just dealing with a traditional long-term care insurance policy, although that is an option, but there are hybrid policies that may include a life insurance policy, that may include an annuity. Can we talk through what they are, how they work, and who they might be good for?
Perfect. Sure. So as you mentioned, Jean, correctly, the sort of traditional policy is a standalone policy. You pay a premium. If you need benefits, it will pay out a certain amount on a daily basis. Okay. If you never need it, then you have the psychological benefit of knowing that you were protected, but you didn't need it. Think about that one like, fire insurance. We all pay our premiums, but nobody's happy if they actually have to use that policy. The same thing here. Now, you're talking about what is really a sort of a bright spot in the market, which is these hybrid policies. A hybrid policy, you mentioned, I think, life insurance. So imagine this, you buy a life insurance policy. Right now, that benefit is paid not to your benefit, but to the benefit of your heirs.
Right.
When you pass away, there's a death benefit. The way a hybrid policy works is that if, on the other hand, suppose you have a policy that pays $100,000 death benefit or $50,000 death benefit. If you have long-term care needs, that benefit basically gets accelerated and can be used to fund those needs. So that's one type of policy. Also, you can pay a little extra and maybe buy more than even that full death benefit would provide. So if it was a $100,000 death benefit and you paid a little extra for long-term care needs, it might pay $125,000, something like that. On the annuity side, go ahead.
Before you get to the annuity, I just want to be specific for people that this is not going to work with your term life insurance policy. This is going to be this is going to be some form of permanent life insurance that
Correct.
lasts as long as you do, because A, you don't want to get to the point where you're age 70 and the term payment is going up and up and up and you can't afford it. But term policies are generally meant to terminate.
Yes. Thanks for that clarification. Absolutely right. Absolutely right.
So on the annuity side, what are you seeing?
Yeah. So on the annuity side, it's also very interesting, which is that, you think about an annuity as permanent income, right? After a certain point, you start getting a permanent income. Here, what's interesting is that if during that period you become disabled, you need, long-term care, then you get a kicker. You get an additional benefit. And the reasoning makes a lot of sense, which is that your expenses are going to be going up. That's the underlying assumption. And therefore, the annuity value that you require to stay in your home is going to be greater. So it will kick up. Again, there are options where you can have it, how much you want it to kick up is your decision. But here's why these are growing in popularity. They're growing in popularity because people feel that in all circumstances, they're going to get something out of their policy, some benefit out of their policy. A lot of people still have problem with the idea that, boy, I have a standalone policy. I could pay premiums for 20 years. And if I'm one of the 50% who never need long-term care, I've paid all these premiums. What have I gotten back? But it's more of a mindset than anything else. With the hybrids, it's either going to be the death benefit, the long-term care benefit, or a combination. Same thing with the annuity.
I've got to say that's the way I went. So I bought long-term care insurance around age 50, which is about the age that you should buy it if you're going to buy it. If you wait a lot longer, if you wait until you're in your 60s, the chances that you won't qualify for reasons of health go up, and they go up pretty significantly. So I started shopping for a policy, and I bought a hybrid policy. I bought a hybrid with a life insurance policy for those very reasons, because I didn't like the idea of paying premiums for a whole bunch of years and then potentially not getting anything for that. And as it was explained to me when I made my purchase, at that time at least, the hybrid policies were a little more expensive than the traditional policies because they were being asked to do double duty. They were being asked to do two things at once. But as you said, you always knew that you were going to get something. Now, that said, these policies are not inexpensive, right? How do you figure out how much of a need you're actually trying to cover? How do you assess how long you're likely to need care and what you can afford to maintain in a premium, and then merge the two to meet somewhere in the middle?
That's the wonderful question, and I'm going to be as precise as I can in my fuzzy answer.
Okay.
So, and here's what I mean by that. So, these are not cheap. So let's start out at the top. Suppose we're a couple, and I believe you can only, you're in a situation where you say we can only afford one policy. Get it for the woman. That's my first piece of advice. Okay, because the risk is much higher for women than for men. Simple statistic: half of men will have some kind of significant long-term care need before they die. Over 60% of women will have it. Okay, so that's number one. Number two, on average, so you have the reason why insurance makes a lot of sense, and maybe we'll have a chance to talk about some public insurance as well.
Sure.
The reason insurance makes a lot of sense is because it's a very uneven distribution of the risk. There are some people, Jean, who will never need it, like roughly half of the public. Okay, but then you've got some people, like 15% or so, who are going to need more than 5 years of care. So there's a very big risk out there. If you said to me, well, Mark, what's the average need? The average need is around 2 years. Why I'm saying that I have to be a little fuzzy is nobody knows whether they're that average person or they're the person that needs nothing or they're the person that needs a lot. So the way that I would tell people to think about this is, look, everyone has competing demands on their money: mortgages, saving for college, saving for retirement, and so on. I would figure out what you think you can reasonably spend on a premium. And I would then go to my agent or what have you, and I would say, okay, what does this buy me? My contention is, because of the leveraging of insurance, that some coverage is always better than no coverage. Okay? You mentioned, Jean, that you bought the hybrid. And for good reason, you wanted to make sure that you got something out of your policy. Just to put this in perspective, even for a standalone policy, I once did a calculation. If I paid a premium for 22 years, okay, 6 months of care costs would be paid for by all of that.
Wow.
So that's how expensive this stuff is. So you get a lot of leverage out of the insurance. That's my only point.
You mentioned the state programs, right? And these have been nibbling around the edges for a while. Washington State is the furthest along in looking as a state how it might be able to step in and help defray the costs of long-term care for people. Can you talk about what's happening in the world of government, how the different states are looking at this issue, why they're looking at this issue, and what we're likely to see emerge?
Sure. You're right about Washington State, and just like other states, there are about 6 or 7 states that are really actively looking at this issue, and they're motivated primarily by the fact that their public expenditures in Medicaid, which is a welfare-based system, are growing a lot. And as a matter of fact, it's starting to represent 35 to 45% of state budgets is Medicaid. And a lot of states are thinking this isn't sustainable. So we have to do something. They're also looking at their middle class residents who have, like I said, have done everything right, and all of a sudden are becoming impoverished and making claims on the social safety net. So the long and the short of it is that for many states, the cost of doing nothing is now greater than the cost of trying something. Washington State is a great example of that. So they have put in place, and it will be implemented in another year or so. Right now it's in the process of getting everything in place, but a social insurance program where people will pay about 0.5% on top of Social Security, like a half of 1%.
Yep.
And if they become disabled, they will qualify to receive up to $36,500 in long-term care benefits. And everyone in the state is going to be part of that program. It's a mandatory insurance program. Other states are looking at caregiver relief programs. Hawaii, there's 2 programs that does that. Minnesota's in the process of trying to make sure that some of the insurance plans that are offered in the state cover home and community-based care. So you see the states acting really as laboratories. And you mentioned this earlier, and you're quite right about this. With respect to Medicaid, because it's a federal state program, there's a lot of variation. And so what might be covered in one state may not be covered in another state, like types of assisted living, whether there are big waiting lists for home care. It's worth checking, but granted, it's complicated. It's complicated for professionals. I still get confused by some of this, but there's quite a bit of variation out there.
Can we go back to Washington State for a second? So I'm just curious about why they landed where they landed, right?
Yeah.
And if other states are likely to follow course, how did they decide $36,000 would be the benefit that people could tap into. I'm sure there were a lot of actuaries in a tower running numbers for a very long time,
Yeah.
figuring out what was affordable, what was not affordable, and what would, what this would likely pay for. But if you're thinking about home care and having somebody come into your home, what kind of relief is this going to provide?
Okay, so great. That's a great question. I was fortunate enough to do some work in Washington State, and there are a couple things to know. One is the 36,500 is basically $100 a day benefit for a year. Okay, so that's number one, and they came to that because of political reality. The question became, well, like, what do we think we can raise in terms of a premium Social Security tax that will be palatable to the public and provide meaningful benefits? And so that's how, so it was sort of like, we think we can raise point X, whatever it was, 0.5%. Okay, what does that buy us in terms of program benefits? And they could have gone a lot of different ways. I think the state felt that they wanted to make sure that anyone who becomes disabled right away will benefit. So you might say it's a very modest benefit, but anyone who becomes long-term care needy is going to get it. Another state might decide, we're not worried about everybody. We're worried about those people who really have catastrophic expenditures.
Mm-hmm.
And so maybe we'll have a program where we say, if you have long-term care for greater than 2 years, then we're going to pay. It's up to you, maybe getting a limited private insurance policy, savings, your family, what have you. You take care of the first year or two, and then the state will come in. So there are all sorts of ways to cut this. And I think states are grappling with what's the best way to do this.
Well, and they're grappling, as you said, because the alternative is worse, right? Putting this on the books is going to be less expensive for the states than not putting it on the books. And Medicare is learning the same thing in certain ways. And I know we talked about what Medicare doesn't pay for, right? And that it doesn't pay for long-term care in most cases. But there are a small slice of benefits that Medicare is starting to pay for, like rides, for example, and food in some cases. Can you talk about that expansion? Because I don't think a lot of people understand it, and it's helpful to have in your back pocket.
Absolutely. There have been, change does happen. And in 2018, the special supplemental benefits for the chronically ill, there's a bill that came in that was passed that applies primarily to people who are enrolled in Medicare Advantage plans. And these plans now will cover a modest amount of non-traditionally non-medical benefits, right? So, and what you've seen is a real proliferation across plans covering things, just like you said, non-medical transportation, some meals, basically focusing somewhat on the social determinants of health, some limited home and community-based care. So there are expansions. I think people understand more. You can't separate out social determinants and strictly medical determinants. And you have to address both of them. And if you ignore social determinants, you're going to get more costly healthcare costs. So I'm glad you brought that up, Jean, because it is something that is starting to proliferate. And there's research done by Ann Tumlinson Innovations that really documents the growth in these benefits.
Which sort of brings us back where we started, right? With the link between your health and your finances. A number of years ago now, I wrote a book called Age Proof with a doctor named Mike Roizen, who was for many years at the Cleveland Clinic. And what I learned from him was that although we have this perception that the vast amount of healthcare spending in this country goes to pay for our oldest living people in their final years. In reality, that's just not true. And the vast majority of our healthcare spending goes to take care of people with chronic conditions, which, if they manage them themselves a little bit better, would do a lot both for their health and for their finances. Can you talk a little bit just about staying healthy and why staying healthy is a really good financial move?
Oh, yes. I mean, when you look at the data and you see people who, for example, don't take preventive care measures, they're not watching their diabetes, their A1C or, their cholesterol and so on. What happens is, first of all, you may have to leave the labor force early. You may have to make job accommodations so you don't have as much time to accumulate resources. Second of all, because of the copays and the deductibles, the out-of-pocket expenses that people experience that have chronic illness are much higher. And talk about a triple whammy. The triple whammy is that on top of that, if you have multiple chronic illnesses, you're much more likely to have long-term care needs as well. So if like the best piece of advice I could give then about your financial security in old age would be, first, do the easy stuff, protect your health, go for those walks, make sure you're getting exercise, obviously don't smoke and so on. Because if you don't, those added expenses are going to take away from your ability to live independently during retirement and age in place in your home or in your community. There's just no question about it. I'm glad you brought us back to that.
Yeah, absolutely. Before we wrap here, Ronnie would like to know, where's the best place to shop for long-term care insurance?
I'm not sure if there's one single website. AHIP America's Health Insurance Plans may have some resources. Most long-term care insurance is still sold by agents. And by the way, the reason is because it tends to be complicated for people.
Yeah.
And so you really have to talk to somebody precisely to figure out, well, what's going to work for me? How much money do I have to spend and so on? So that's what I would say. Is that you could Google it and you may get specific companies, but I might start there.
Yeah, and if you have a life insurance agent, it's going to be that person, right? It falls in the same bucket as your life insurance, your disability insurance. It's on that side of the equation. It's not the same side as your property casualty.
Oh, absolutely.
Insurance.
Right.
And so that's the first place to go. Marc, this has been terrific. Great information. Where can we find out more about you and more about your work?
Well, thanks. I'm at the Leading Age LTSS Center at UMass Boston. I think if you put in ltsscenter.org, you're likely to come up. And there we talk a lot. We have different work areas and papers on this and presentations. And I'd be delighted to, provide that and be as helpful as I can. I said to Eugene right before we started the program, I often feel like Don Quixote swinging at windmills over this issue, but we have to keep pushing our policyholders, and we have to be smart about how we take care of ourselves.
Yeah, 100%. Thank you so much for being here with me today. If you all are looking for additional information, please go to our website as well. It's protectedincome.org/bucket list, protectedincome.org/bucket list. And we'll see you here next time. Bye.